Hello, everyone. My name is Jim Nelles, Chair of Kensington. I'm here with our new CEO, Adil, President and CEO, and we thought we'd sit in the garden here at Kensington, the personification of Kensington Gardens, and talk about the first 100 days or so since you began. We've got a few questions. And we really just want to have a chat. We've done this before, and it seems to meet with a very positive reception. And so we hope it brings us all closer together. And with that, how the first 100 days been?
Well, looking at around us in this garden, it has been absolutely amazing. It's been great because I've gotten a chance to meet so many of the teams across Kensington Health. And every one of the team members and teams has a story behind why they're there. And there's so many people here who have been here for more than 15, 20 years, which is quite remarkable because there's got to be a reason why they're here. And all of them keep saying, well, it's the people I'm working with and the people I'm working for. And that first 100, 150 days or whatever it is, Jim, has been so meaningful because that passion has been contagious.
Yes.
Right? And so you're walking into an organization that is passionate about what they do, loving their team members, and just want to pay it forward to others. And so it's been remarkable that way. Learned a lot.
Okay, we're talking.
Learned a lot, both from the history of the particular area and how it came about to how they changed over time to serve the needs of our community. So that's been a lot of learning and internalizing for me, but an important step for me to understand where are we going to go together as we start to craft the road forward.
I hope you can probably hear the birds in the background, so they're whispering questions to me. Among other things, we solicited some questions, and so with your permission, we'll give you a chance to answer them. One of the family members of one of our long-term care residents wants to know and comments on staffing levels on my mother's floor, that they've sometimes been low. Any thoughts or comments on that?
Yeah, it's a significant challenge that the entire healthcare system is facing, right? Related to what we're trying to do right now, all of healthcare has experienced this type of challenge in that through the pandemic, and our teams have gone through so much through the pandemic, their health, their wellness, but they've been also resilient. And that's another learning
Yes.
that I got from the last 150 days, that our teams are resilient. But the system at large is challenged with health human resources. And we are part of that system. We too are challenged with those health human resources shortages. You know, the part that we're really working on right now is last minute cancellations. Some of our staff, they're ill and they don't want to give that to the residents. They're in from a point of protection of the residents, they're calling in sick.
Yes.
The challenge is, how do we actually get people to fill those shifts at the very last minute? And we're working on so many strategies to be able to fill those shifts. And that's just bodies helping people. The other thing that we've heard is we really like the continuity of the staff that are looking after my loved one. That familiarity, that environment is important, right? And we fully, and I fully appreciate that to many of the people we serve, this is their home first. And then care is put there for their home. And part of a home is familiarity.
Yes.
So we are deep diving into understanding continuity of staff for that connection to our residents and our family members, but also last minute, if there's a cancellation, what does that do to the team delivering that care And how are we able to provide that person to deal with that? It's a team sport.
Yeah.
No one practitioner delivers all the care, and we fully realize that. Long story short, it's a real area of focus for us, both on immediate need, but then continuity. And we're looking at strategies with our health human resource team, our clinical staff. We're also looking at new ways of delivering the care.
Yeah.
And we'll get further into realizing that. I guess the immediate concern that this family member has is short staffing immediately. But I would say we're going beyond just the short staffing into how are we ensuring that continuity.
Yeah. So next question from a colleague is curious as to what you've learned about the team and what do you think needs to change?
Wow. It's a great question. Similar to what I had answered before, what I've learned about the team is that they're very, very in tune with their purpose of why they're here. Our various entities within Kensington Health as our one family are amazing at what they do, right? So the Kensington Gardens team knows their work inside and out. They're very nimble. They know how to deliver the best top quality care, and that speaks volumes to why we have such a wait list coming in.
Yeah.
Top-notch care. Now, do they know enough about what's happening at the Kensington Eye Institute and vice versa? I think what we're really trying to do moving forward is live the one team approach. And one team goes beyond the current institutions within Kensington Health to broaden our family approach. So, for example, looking at how can the Kensington Diagnostic Center service some of the residents here at the Gardens. It's just across the street. So how do we actually use those assets together so that families aren't having to go to Toronto Western Hospital for diagnostics that they could get right on site?
Yeah.
Easier said than done. But we're starting to have those conversations across those, let's call them sandboxes.
Yes.
And what we're trying to create with this Live One team is one large beach and not individual sandboxes. And how can we take advantage of all the great services that we have at Kensington for our entire community? So that's a main area of focus that we hope to move forward on.
So building on that, if somebody were to ask you as they sat in the garden at Kensington what your priorities were for the coming year, what would you say?
Well, first and foremost, we're going to do a strategic plan. We've had strategic plans for our individual entities. I think we need one cohesive, enterprise-wide strategic plan. So a lot of engagement we hope to do with strategic planning of our staff, of our board members, our community, residents, and patients that use our services. We hope to do some engagement on that. So strategic planning for sure. The other thing is the Live One Team approach. So that's a critical piece that we're going to be focusing on. Our leaders across Kensington are coming together. Our medical directorship are coming together to start having those conversations about what can we do better together. The other thing I learned was everybody at Kensington is a caregiver. Whether you're a person at the front desk, or you're a nurse or a PSW in the front line, or you're a board member, or you're a management staff, we are all caregivers. And that's got to be amplified because everybody has a role to play in that experience for the patient, client, or resident that we're dealing with, or you're working together. As a caregiver, you're caring for your team too, right? And you made a point of this through all the other calls that we had through COVID. We were looking after each other as well, so we're all caregivers. And the other part that I really want us to think about going forward is everybody at Kensington is a community developer, right? So living one team, we are all caregivers and we are all community developers are important mindsets that I hope that we can push forward. All of that is centered around the one team approach. So we have an enterprise-wide quality plan now. And what are we doing to make sure that we're delivering not only great quality as we do now, but how do we make it better and how do we pay that forward to other communities? It's exciting times. And the other area of focus is our diversity, equity, and inclusion work.
Yes.
The community we serve is vibrant, various types of people, various socioeconomic groups, various cultures. And what are we looking at from a DEI perspective for our teamwork, for our medical model, and our community outreach? How are we creating and advancing that mission of new meaning to community care is another area of focus.
Okay, well, thanks, Adil. That we've the comms team is telling me I need to wrap. I could chat about this with you for hours to come.
Me too.
But we can't. So with that said, I know you referred to the strategic planning process that you're going into shortly. So please know that, and you folks out there also know that we'll be consulting with you as part of the strategic plan. Kensington has always been very much a family. And it's one thing to say you're a family, but you have to act the role as well. And I think, as we've alluded to before, the strategic planning process will take into account that family process. And please know, on behalf of the board, but on behalf of staff members and families and residents, that we're here to help you realize those objectives.
Thank you.
And with that, I hope this has been helpful. Thanks very much for taking a little time to spend with us. And we will see you all in the corridors of Kensington very soon.